coming back closer to home in Singapore, I think and you may be following the news recently. I mean, I think it's a multi-pronged strategy. We're talking about early detection and also getting everybody vaccinated at the earliest so that people can go about their lives. They can go about their work. So whether it's construction, getting the workers back and not stalling the construction projects, or it could be for leisure. So cruises have started, and then how we are using wearable and AI to track and do contact tracing. So we'll have examples of that. So today, let me introduce our speakers who will talk to these great stories. Next slide, Camilla. So first up, we will have Syed. So who is, he's a senior principal in the government practice at SAS Institute. And he will be sharing examples of what I talked about on the social care, healthcare benefit side. And then after that, towards the end, we actually have Jaslyn from a company called TraceSafe. It's a very catchy name, and but more than the name, I think you probably are experiencing some of their solutions already in your day-to-day life, right? So there is, it's already being, if you take a Royal Caribbean cruise, say a few months from now, you will most likely be given a band, and that band can help sort of track you. And if there is a case, then it can be used for contact tracing. It's also being used for construction. I mean, TraceSafe also was an Innovation Challenge winner in the OIP program. So you will hear about those stories from Jaslyn. So, thanks for joining us, Jaslyn. Then we also have, next slide, Camilla. So we also have Chiling. And Chiling is a deputy director at Open Government Products. And actually she started with Ministry of Health when she started. And their whole emphasis on building, I think, a few things. One is the sort of open products, which not just government agencies and the private sector can tap on and sort of come together and innovate. But secondly, a lot of focus over the last 12, 18 months on building some data backbones and central sort of foundational technology in terms of not just getting data in for the rapid testing for COVID-19, but also deployment of vaccines. So they're trying to do two things using technology. One is on the demand side, right? Because the demand side is how many people are there, who needs to be vaccinated, when do we do that? And then on the supply side, making sure the right amount of vaccine is available, and based on different areas in Singapore and how you deploy that. So you will hear a lot about that from a technology and analytics point of view from Chiling. But what they're doing is really critical to hitting that target of 70% vaccination by National Day. So without further ado, we will hand it over to the speakers. Just a few housekeeping rules before that. Basically, we will we are recording this session, so we hope we have your permission to do that. Secondly, if there are any Q&A, you can actually put it on the Q&A chat, and then we will take the questions from all the three speakers at the end. So if you can write the question and then say which panelist you want to ask the question from, then we will take it in the end. And in the end, we will share a QR code. Please take the time to give us feedback so that we can continuously improve. So I'm really excited about hearing from all these great panelists. Let's get started. Over to you, Syed.
Okay, thanks, Manik. Just sharing my screen. Hope everybody can see that. Um, so, good afternoon, everybody. My name is Syed. I'm actually principal for Public Sector for SAS. And today I'm going to be talking to you about how we use analytics to handle all the responses that or the challenges that we face with COVID-19. I initially prepared this material late last year, and it was actually rejected by the SAS chapter because they were worried about COVID fatigue. But who would have thought 7 months later we're still talking about COVID, and it's after maybe wave 2 and wave 3. It's still not over, and it's morphing into something that we need to handle as part of our daily lives. And the reason why I wanted to address you today is actually to look at um, the, the way we try to handle this disruption. First of all, of course, the first phase, I think we faced the first phase, which was last year. How do we actually respond to that kind of situation? How do we actually achieve situational awareness? I would call it actually situational intelligence actually, because you just don't want to have information with you, but you want to be able to also make decisions. And the approach is actually to get more data, more reliable data that you can actually report on and act on. And of course, you try to respond to those changes by adjusting certain parameters, adjusting habits, adjusting your processes, and of course, mitigating disruptions. Some of these, unfortunately, some situations we never faced before. We never faced a closure of retail malls. We never faced a complete stop of dining out. Those kind of situations. So it's very, very important to keep learning from this situation and be prepared for the next round of uh, disruptions. The next phase is actually recover, which is actually to understand or rebuild the processes around and have analytics in place to operate in this kind of a new environment. And that's where in my example today, we share how some governments, and obviously Singapore as well, how do we adapt to these changes? What kind of effect does it have to our social landscape, and how can we actually facilitate assistance within the social and healthcare landscape? As you know, the population is also aging. We need There's a lot of people who need assistance, and there's a lot of job loss in the market as well. And finally, of course, to imagine, initially when I prepared this section of Reimagine, I was the only speaker who was on board. But it's good that today I have Lichin as well as Jaslyn as well. Maybe they can also share what are you expecting in the future? What is the new norm, and how do you build resilience around it? Obviously, we can just share from an artist's point of view, but actually from a behavior, from what do you call that? Health and well-being. I think we can have some insights and good discussion today. So obviously, when we talk about situation awareness, you need to have a very good set of information, uh, good apparatus to collect data. And initially, there was not a lot of information which was available. And it's really, really important now that all the government agencies, as well as healthcare institutions, have really tapped on this kind of capabilities. I think Singapore is well upfront in terms of having the ability to do contact tracing, for example, all your trace together devices, as well as the mobile devices, to be able to understand movement or patterns. So it's very important to have identification of coronavirus earlier, all your testing kits, and you leverage on that information and you consolidate the information. Then after which, it's also very, very important to identify the risk areas, or the areas where the population is very, very susceptible. I think you know, maybe especially in the developed countries, like for example UK, uh, they're well known, and what do you call it, institutions where it's highly susceptible. For example, the old folks homes, they have to quarantine those areas. So you can actually build risk stratification models to actually identify the individuals and communities. And this change has actually, I think as you know, last year it was the aged, those people above 60, but now it looks like with the new variant, it seems to be more. Um, it seems to be more dangerous to the younger population as well. So the other aspect of it is actually to ensure access to treatment. And this is the part where everybody within the healthcare industry is actually worried about. with a lot of hotspots emerging, and you have a high risk of for patient, um, which is catered for at risk, how do you actually ensure that you have enough beds and facilities to be able to cope with that kind of demand? And you have instances where there are countries around the world where they can't really cope, and it just the entire services part of it will be just collapsing, and people will have very little trust in the ability for the government to respond to this kind of situation, which results in you don't want to result in this kind of a chaotic environment. And of which, when you identify those areas where you have gaps, you need to identify the resource allocation, which is, of course, the beds, the facilities, the investment as well as the personnel to be able to handle that kind of demand within that crisis. And finally, of course, using analytics to predict future needs. So you have epidemiology models to look at the risk characteristics for those people who are at risk. Okay, so I think this actually summarizes what I was talking about. The high risk populations that I was talking about was based on maybe last year's first and second wave, but we know that our third wave is slightly changing as well. There's also a lot of inadequate healthcare resources within Singapore, as well as all those agencies who are trying to cope with that, and of course, public response to actually help. And that's why the information dissemination is also quite useful. I'll try to be fast here because I've got not a lot of time to cover such a big topic, but actually the role of analytics is not only just to be able to suggest or help with decisions, but also to consolidate the data that you have from all the various apparatus, from the healthcare institutions to the public systems, to immigration and border systems. Data management actually is a very core part of your ability to be able to derive decisions from analytics as well as insights that you generate. And as you know, right, there are a lot of dashboards. If you go to Google, you have a lot of dashboards. And the dashboards actually initially, right, there was not a lot of trustable dashboards when we came with the first phase. But eventually, agencies and governments are working together to share information. And it actually gives a good depiction of what is actually happening. And to the normal citizens as well, with this kind of information that you see across the eye, which is available freely, you'll be able to actually assess your the risk. And you know when the risk status is high, you don't go out. And it's able to give you geographical analysis. So those people who are living at the high risk areas, it's best for you not to go out, not to dine in. So it actually helps to inform the public and disseminate information that you need very quickly, instead of waiting on news bulletins and so on and so forth. The other aspect of it is using analytics is actually to do predictive modeling, to do a risk assessment. This information not necessarily is available public, but I believe that Singapore government as well as the what you call healthcare institution, they have this kind of modeling in place, looking at all the chronic response that you have, those people who are enduring the disease, what are the risk factors, and to be able to actually access better those people who are high risk, low risk, and what kind of attention and care that they need. Okay, and whilst this information is actually being churned or as well as being analyzed, those salient points that you have an understanding on, you can actually push it back to the public sphere, making sure that the so-called that penetration of risk within a geographic area is being shared, and you can publish this information back on your dashboard. And also some of these things like what you spoke about, resources, beds, occupancy within a hospital, you can actually share that as well, to make the public aware of not only the situation, but also to be planning or to be planning accordingly to adjust to according to the scenarios that um, uh, um, the crisis has. And if you actually drill deeper, this could be an internal dashboard where you use the analytics to do a bit of forecasting. What is that rate of resources in terms of bed, staff, if this trend were to go higher and higher? And I believe this was the approach that was taken maybe during Christmas last year in UK as well as Europe, when they were looking at the trends going high. They will predict that there will be a certain tipping point where the healthcare services will not be able to cope. And using this kind of forecasting techniques, that's where they will actually make decisions, very drastic decisions, like, for example, complete lockdown or social distancing policies. And of course, the other flip side is actually to take care of our healthcare workers. So looking at the resource optimization, looking at the trends of exposure for these healthcare workers, and making sure whatever we have from the risk models, the risks that they are not exposed either through the practice or through certain methods that we employ within the healthcare sector. Okay. And I'm going very fast. I'm sorry about this because I've got two other speakers. But hopefully, if you have any question, you can visit some of these points later. I can address that to you. And of course, when you have this kind of assessment through the dashboard, you can actually look at the high risk cases, looking at the ability to actually assess what will COVID actually affect in terms of other diseases, like for example, cancer, because let's say all the operating theaters as well as the ICU is being taken up by COVID patients. What does it affect to other diseases, those people who are facing other diseases as well? So you can do that kind of analytical modeling to look at the exposure and to the hospitals and healthcare institutions. And of course, looking at monitoring of supply of beds and resources. And the last but not least is looking at epidemiology models, which is looking at R rates and so on and so forth. Um, SARS, of course, they have our own epidemiology, but I'm sure the Singapore government as well, CDC as well, they have their own epidemiology models. And you can actually look at it from an analytical model per se, or looking at it from a contact tracing point of view. So that means you actually cultivate all that information that you have through all the devices that the people carry and see, look at their exposure and the rate of infection. Now, let's look at the second aspect of it, and I'm going to be very, very quick. The challenge, of course, is after we assess all these, what is the impact of this to our society? And I think Singapore specifically, right, there has been unprecedented support for the public. People are losing their jobs, but people who are in need special type of care. The aged needs certain assistance. What happens when the parents is actually sick and there's nobody to take care of the kids? So there are certain initiatives that are being rolled out, but what are the best way to actually roll out those kind of um, support kind of initiatives? So analytics is actually helping you, will help us actually to target the benefits, getting the right benefits to the right people, and understanding what kind of impact that they would have. And also, you also want to manage the demand for these kind of things because you don't want them to be completely on the dependency for a long time. Because one, you have shortage of resources, as well as the the kind of the kind of dependency that it needs will slowly change over that period of infection and of after infection as well, and optimizing the people and the technology to need to deliver so that they can actually self-service. I think there's certain initiatives that we roll out which are completely self-service, and of course using analytics to safeguard you from risk, either from financial risk or operational risk. So these are some of the examples of initiatives that are rolled out worldwide. Um, I think we took this from WHO, I guess. And there are various kind of initiatives rolled out by government, like for example, unemployment benefits, expanded sick leave, cash transfers for household, deferred household costs, deferred payment of loans, personal tax income flexibility, and targeted benefit for at-risk populations, such as what Singapore is actually doing actually. And one of the things that you want to be able to do is to cater for your beneficiaries, and that's where what you call as segmentation is actually being utilized. So looking at those people who has maybe long-term needs, and maybe whether we have everything that already in place for those people maybe who have temporary needs, those people who have the ability to work, but they have no income because their jobs are severely affected by the lockdown, for example. Those people who are not in need, they are financially stable. They don't have any severe exposure to COVID, and their income is not affected. But they are fraudulent gamers. They want to game the system. They want to be part of the beneficiaries that the money has been given. They want to be able to take advantage of that. And of course, those self-employed and having this kind of what do you call it, kind of profile to be affected, what kind of needs that they have that we can actually service. So the idea is to not only looking at segmentation, but also looking at the challenges, whether we need to establish it in terms of short term and maintain in terms of maybe median intermediary term, as well as the long term, which is the support reduction over time. So this we will establish through having a very, very good holistic view, sharing all that data. And I know Ministry of Social and Family Services are trying to do this. Most agencies who are dealing with social and welfare try to collect as much as information as they can to be able to establish those people who are in need. They're not reaching out, and I think if you know and if you work with social services, these people are the least connected people. That's the challenge actually. How do I get access to them? And they don't necessarily volunteer themselves for help. Some of them are needy, illiterate, age. They don't have devices with them. And how do we reach out to them? So the outreach is important. Therefore, a lot of data is needed to be able to collect, to be able to reach out to these people. The next phase is actually to maintain, and of course, to have a beneficiary system that actually is automatic and self-service, but at the same time optimized to suit the most beneficiaries which are needed most urgent, what kind of assistance they need, which are catered to the profiles that we spoke about previously, and also a system that is robust enough to prevent and detect fraud. And with I think with all the technology that we have today, the models can be readjusted according to the situation, whether it was a situation of the first wave, second wave, third wave, and so on and so forth. And finally, of course, to have a plan going on forward. That's where longitudinal analysis will come to play, looking at how these beneficiaries will actually transition into self-sustenance maybe after 6 months or 7 months. So doing those kind of models to be able to analyze and maybe and you can track the transition for those people within that bracket. Okay, there is a huge problem having this kind of implementations. Like I speak of previously, segmentation models, predictive models. These are very well-known techniques which have been applied to in the commercial banking sector. However, when you apply it to social and welfare, it's a very different challenge. One, as I spoke to earlier, is that the data is not really reliable. That you have a lot of sparse data, and the second challenge is actually how do you quantify these people? How do you quantify the risk? How do you quantify the impact? And how do you quantify the what do you call it? That assessment that you have actually made? And COVID actually gave a lot to other peripheral problems, not just on the disease. And this is one example. family violence, for example. So these are some of the challenges that we are all ongoing facing in this kind of landscape. So there's no other way to do it but keep on collecting information and measuring them. So these are some of the uh, what do you call that, dashboards as well as models that we actually simulated. One of it is, of course, looking at claims. Claims, to a certain extent, can be actually channeled to beneficiary and claimants um, uh, within Singapore as well. And you can actually analyze that information and make as much as assessment as you can to, to look at what kind of um, analysis that you can do. So you can see these are the type of claims changes over time, and which states has higher claims, what kind of claims they have by county, who are the families who are actually associated with them, and maybe see what kind of assistance and what kind of reimbursement that has been actually done. Okay, in the interest of time, maybe I'll just go on ahead. Okay, this is my last section actually. So what's the new normal in healthcare? And I hope my other speakers actually can also contribute on this, because this is continually changing as we speak, right? We go up and down. And the general part is actually, of course, without a doubt, we have to measure and monitor. And of course, we have to mitigate risk. And I've spoken to you about how do we actually measure and monitor, which is through data management, to certain types of dashboard, forecasting models, and so on, and how do you mitigate risk. But this, as in any analytical process, actually you need to actually do it iteratively, which is that you have to do review and refine continually. So in the area of social welfare and services, they have to do this kind of analysis over time, identify kind of the beneficiary kind of demand, report regularly, of course, look at those citizens that have missed the gap, identify those kind of risks associated to those people, and making adjustments along the way. And of course, from a maintenance point of view, understand those kind of interrelated issues that come into play when COVID is there. It's not only on the health risk, but also on other risks as well, family violence, support in terms of education. We were talking about devices as well. Some of the poorer households, they can't afford devices. So you have to track all these kind of information as well, feed it in systems, and build a system that is robust enough to be able to automatically channel kind of some kind of reimbursement, prioritize certain cases, as well as being robust enough to not allow people who to to take advantage of this kind of monies being reimbursed. Okay, and of course assess the impact of support across the whole landscape. And finally, having a support reduction, a complete beneficiary life cycle. This has to be charted from the short term, intermediate, and long term, and have a system that actually that can identify and take action against fraudulent behaviors, as well as proactively channeling these kind of models on an ongoing basis, and finally matching that kind of needs to the business users. Okay,
Hey,
I'll
Syed,
just
sorry to cut you
yes,
off. I think in the interest of time, if we
yes,
can,
yes.
maybe
This is my
some
last slide.
last.
Yeah. So
Okay.
yeah. So this is my last slide. So there are very techniques within vision, text analytics, predictive analytics with AI that can help you on this, and it actually will help the entire life cycle of this kind of analysis, looking at the COVID responses as well as COVID modeling, from consolidating the data, generating insights, and generating all the multiple scenarios, assessing its impact, and making collaborative decisions, and eventually executing those decisions. And this is a continuous cycle that we need to take. It's not going to end. We need to fine tune this, and needs to be adjusted at every ups and down that we face, every wave of COVID that we face. With that, I'll end my discussion. Thank you.
Thanks, Sayed. So, I mean, the one takeaway from me was that, and I was reminded of a saying by Dwight Eisenhower, who said that, plans are nothing, but planning is everything. And I think that has really come very true during COVID-19. Sometimes, I mean, we make plans and then we think cases are under control and we, remove the restrictions, and then suddenly situation change. There is a new variant, and then we have to quickly be agile and start the planning and adjust our plans all along the way. So I think Syed's last slide, which also talks about this, it's not a capability which you just build one time, but I mean, using data and analytics to keep track, monitor, measure, so you know what's happening, and then you adjust your plans at a very fast and agile way. I think that's really the what really hit me. So on that note, well, thanks, Syed, and I will now invite the next speaker, Chiling. So Chiling is a deputy director at Open Government Products and the Ministry of Health. She started her career with the Prime Minister's office, and then since then, she's been pretty busy over the last 18 months, developing systems for rapid testing, vaccination rollout. So I think if we are where we are today, this could be, one team we have to thank for. So let's get under the hood a little bit, and then over to you, Chiling. Thanks for joining us.
Thank you, Manik, and hello everyone at the forum. I'm very glad to be here, and Hong Yi sends his apologies. Unfortunately, he's called to another meeting, and so yeah, like Manik said, you can plan all you want, but Murphy's Law. I hope I'll still do the team's work justice by sharing with you some of our COVID-19 tech response. Now, as you might know, in the past 12 to 18 months, the government has had to roll out quite a lot of products and systems to support COVID-19. And this ranges from trace together, contact tracing, to quarantine, to testing. And finally, now we're in the thick of vaccination. So let me share a little bit about Open Government Products involvement in COVID-19. But before that, let me share a little bit about us. We are an experimental team of engineers, designers, data scientists, and product managers who are working in government to build technology for public good. A relatively young outfit of about 2 years old. We were set up about 2 years ago with this thesis in mind, which is, what if we had built an organization that operated like a modern tech company but worked on public sector problems? The idea was, if we could bring in the best engineering practices, bring the best talents in software engineering, we could do quite a lot. But instead of working in a private sector problem statements, we could work on public sector problems. And in COVID, I think there's been a lot of room and scope for the team to really think about how to move fast while keeping things simple and keeping a user-first mentality. So maybe let me share some of our products to date. You might have heard of parking.sg. That's a product that a lot of people use if you're a driver, especially. That's our first product that we've ever built. And since then, we've expanded to, say, more than 15 products. On this slide, all the products we've built to date in the past 2 years, and many of them are actually building blocks for our COVID-19 response. Imagine this as sort of like Lego bricks, which we put together to form end-to-end solutions to support government in their operations. Our mission is to experiment with new practices in engineering, as well as in problem solving within government, to demonstrate that these practices can work successfully and in a cost-effective way. And what's also important to us is that we don't just work in silos and keep churning out products, but we also help the rest of public service adopt best practices that have been proven to work. So we are very much an experimental unit, and our goal is not just to build technology products, but to experiment with best practices across human resource, team management, etc. So in this, amidst COVID-19, actually, we've had the chance to work very closely with agencies, in particular, Ministry of Health, to really look at ops tech integration. And I think that's a word that many of you might have heard of, but putting this into practice is quite another set of challenge. Ops and tech usually there is a creative tension between the two. And in deploying a lot of these COVID-19 technologies, we've learned that it's really important for these two to be in a very productive dance, where ops would propose a sort of a concept of operations, and tech not only supports it, but also challenges it to think of more effective workflows. So that's what OGP has done. Some of our products, such as forms, which you might have encountered, actually scaled very rapidly amidst COVID-19. So we started out in 2019. And actually the growth has been quite stable, but amidst COVID-19, we've really seen an explosion in the number of forms that are being created, as well as the number of responses. A lot of this is accounted for by various government schemes that are being rolled out electronically, because paper forms can no longer be submitted or snail mail as easily amid circuit breaker. But I think it's also a cultural shift towards having government services be digital at source, or digital even end to end. So it's been a very, very promising sign across government. And to support Singapore's COVID-19 response, we have collaborated with MOH on 3 fronts. One is on rapid testing. Now, this has got to do with rolling out rapid testing across the nation. You might have heard of the polymerase chain reaction swab test. In the early stages, this was the primary modality of testing. Midway through this year, I think we have shifted towards a much faster form of rapid testing that allows your results to be out in 30 minutes. So our role in this was to ensure that data flows in a very timely fashion between swab test to result. Second is quarantine. For those of you who might have experience with this, you would have been asked to download an application called HOMA, which helps in quarantine enforcement. And now we're in the thick of vaccination operations, where we've designed a suite of vaccination operation systems to support Singapore's phased rollout of the vaccine program. And underlying this is 2 things. One is in the very, very early stages of COVID-19, we had, of course, a shortage of manpower in our healthcare sector, and we supported the manpower division to mobilize members of public to step forward to serve either as nurses or for some of them as swabbers in our testing strategy. And the second enabler to this is timely flow of consistent and reliable data. And that is not easy to do when there are many, many systems that's interacting with each other. So the idea was to stand up a management backbone to serve as a data exchange gateway for all COVID-19 data. So if you have your Trace Together application and you're able to get some of your vaccination status or your travel history within the country in a timely way, it is thanks to, I think, a lot of the data analysts and also the team's work in piping various data sources in a way that ensures timely data flows. So these are some of the solutions we've built, and I'm happy to share a little bit more about how they work in a little bit and what led up to them. I particularly like this slide because it really describes our experience in the past 12 to 18 months. There's a saying that sometimes in crisis, you don't have it all, even if you have planned to the hilt. A lot of us are really building the plane while trying to fly it. Each part of the government may have one piece of the puzzle or one piece of the airplane, and we've had to combine them in productive ways to make sure that it can take off. And one of the quirks or idiosyncrasies about building a plane while flying it is that we don't have a master plan, neither do we know what works from the outset. So it's very much about putting something to test, prototyping it, and retiring a solution if it doesn't work and building a new one that works in quick time. And when it comes to open government products, I think one of our design philosophies has very much been to not build unitaskers, as you can see, very elaborate can openers, as opposed to maybe what's in your kitchen drawer, which is a very simple can opener. If we could keep things simple by using simple tools rather than purpose-built, custom-built unitaskers, it actually helps us save cost. It also helps us save time. The reason being a lot of these unitasker systems are they do take a long development time to bring to fruition. And sometimes when you have you've taken 3 years to build a system. By then, the operational environment has shifted or changed such that the tool is no longer as fit for purpose. So our design philosophy and our product strategy is very much about building tools, like small, simple tools, modular tools for government officers who can then put together. So imagine a government officer now is not strapped to a single monolithic system, but they are chefs all in their own right. With their own operational workflow and concept of operations, they can look around for tools in the digital space to support their work. And these tools are meant to be cheap, meant to work well, and they can be pieced together to form an end-to-end solution. So what's an example of this? For Singapore Healthcare Core, which helped with manpower amidst COVID-19, what we did was to combine 4 of our products together to form, to aid in the launch of SG Healthcare Core. So for the call to action, we have a website that is built via our product Isomer. Isomer is a website building tool that allows officers to launch a website within a day. It helps acquire the domain. It also allows you to do design work via a CRM a CMS, content management system. So this website was actually built within a weekend. So over a weekend, we've prepared the content and launched this within 1 week. And this allowed us to call for volunteers all across the healthcare sector and from the general public. So within the first week of launch, we attracted about 3,000 healthcare volunteers to sign up. And within months, there were more than 20,000 volunteers who have stepped forward through our website to help in the COVID-19 response. So this has allowed us to really rapidly launch campaigns that are very public in nature. It also allows members of the public to register through forms, be notified via Postman, which is a mass mobilization tool that sends notifications to through SMSs or emails. And through go.gov.sg, we are able to share files and training materials for our Singapore Healthcare Core volunteers. So collectively, these tools enable our officers to launch a campaign in short time, engage members of public through mass notification tools, and to start training efforts and through file circulation. The second product we launched amidst COVID was the Antigen rapid testing end-to-end solution to support national testing strategy. In the very beginning, when we first started, it takes about 1 to 3 days for a swab test result to be available through the polymerase chain reaction swab test. And the reason for that is that a lot of the swab test results have to be delivered first to a lab. A lab then have to process the tests, the swab test and specimen. Thereafter, there's the result, which is conveyed via various systems before it reaches the ministry or the member of public is informed. With benefit of some time, as well as new technologies such as the antigen rapid testing modality, we are now able to shorten that time from 1 to 3 days to 30 minutes. So within 30 minutes, you can know whether you're COVID positive or negative. This is the registration form that the team has built to support this new testing modality. And the way it works is this. For every event that is being organized, that's above 50 PAX, today they actually need to register with MOH for ART testing operation. So if you arrive at the event, sometimes you'll be asked to perform a swab. This is the workflow that's on the back end, right? So an event organizer submits an event registration, it's confirmed. And then on the day of when you arrive on site, you are given a registration form with a unique QR code. And in this QR code, there's actually a serial number that is tagged to the test kit. This serial number is pre-filled onto forms. The patient answers a series of questions, and provides contact details, and is able to then access his results via an online checker within less than 10 minutes after a swab. And the patient is then notified through SMS about his results. And this allows rapid transmission of COVID-19 ART test results, both to patients who are tested as well as to the ministry. So on the back end, what happens is that your test data will actually be passed on to MOH. And if you're found to be AG positive, the relevant public health actions are triggered. So this could range from conveyances or confirmatory PCR swabs. So back to some of the design strategy and product strategy that I mentioned just now. If you look at this tool, what it basically combines is two main products, right? One is FormSG. So if you see, this is actually based on the FormSG architecture. And second is Postman, which helps with rapid notification to citizens. Now, moving on to around December 2020, there was first word about a vaccination rollout. And the objective of this vaccination rollout is to achieve herd immunity through a phased national vaccination rollout. And the reason why it had to be phased is because of course, in the very beginning, we did not have vaccine supply for everybody. That was a challenge that many countries faced. So amidst vaccine supply uncertainty, how do we ensure that we can maximize throughput and really get the vaccinations to where it's most needed, for example, seniors who are above a certain age. So a lot has changed before COVID and after COVID. After COVID, a lot depends on the internet. You can no longer just, depend on a visit to a GP to get your vaccination. In the case of COVID-19 vaccine, whereas in the past, you have doctors chasing after patients for a vaccination and reminding them, that, oh, it's time for you to take a vaccine. For right now, in the case of COVID-19 vaccination, it's a very sought after commodity and people do want to get vaccinated as fast as possible and as soon as possible so they can travel, so that the new normal can resume. So it's really changed a lot of things, COVID-19. The special thing about this vaccination program is this, right? First of all, it comes in 2 doses. Second of all, there are conditions such as that you need those 2 doses within a certain time window, 28 to 40 days, 42 days apart. And ideally, you would have both vaccine doses locked in at the outset. So if you look at some other countries' deployment of vaccination program, one of the strategy was to just jab everyone as quickly as possible. That's good, but there's also a downside to that, which is that your second dose is not guaranteed. And when your second dose is not guaranteed, a problem then would be that people miss the second dose and the vaccine efficacy therefore decreases. So there's need at some system level to ensure that both doses are within a certain time window and that we have the supply for every patient. The second is that we need to accurately capture data and for this data to be transmitted from our COVID-19 data management backbone to downstream use cases such as Trace Together, so that after you have been vaccinated, you can access your vaccine records and you can use that for travel. Finally, there's also the issue of safety and efficacy of delivery. From a logistics standpoint, you need supply to match demand, and the delivery of vaccines to the population needs to follow a certain priority phasing. So with all these constraints and conditions built into our operation, how can technology support this? So what the team came up with, I think, collaboratively with MOH is an end-to-end vaccination program product suite, right? These products might be familiar by now. For Isomer, we are able to launch vaccine.gov.sg, which is a website. This was designed and launched within 2 days. FormSG helps with your pre-registration. Postman is the engine behind mass notifications. Vault is a product for data sharing to downstream agencies. And on top of that, we have custom-built components such as the National Appointment System, which I think a lot of you, if you have been vaccinated, you would have encountered some of these tools. So far, we have had more than 4.8 million vaccination doses administered, and more underway. So our journey started really with user tests for pre-registration and the self-booking flow. The challenge is to make this as inclusive as possible so that even seniors know how to use this product. So we have kept the design very clean, very simple, and for registration this pre-registration flow actually helps to titrate in demand as and when vaccine becomes available. This screen might be familiar to you if you've made an appointment. It allows you to basically fill in your medical information and then select 2 slots. right, across different vaccination sites. And once that is selected, you can actually select 2 time slots. And you can see here that the 2 time slots have the time window automatically computed to reduce errors. And once you submit your booking, you receive an SMS reminder as well as the booking details on screen. So I mentioned earlier about the COVID-19 management backbone. What does it really do? In the main, across all these COVID-19 systems, there are lots of different data formats, different data specifications. If we do want the data to be clean and to be interoperable across different systems, we actually need one, data validation. Data validation helps to ensure that all your fields are in the correct format, that inaccurate entries are rejected at source so that they can be troubleshooted in good time. And the second thing we provide is a set of business logic that's consistent. So one example of a business logic would be that your vaccine status is only effective after 14 days of your second dose, right? If you had various different systems all carry this business logic, there would be inconsistencies and desync across them. So the idea is that if you have a central management backbone, all that could be consistent. So the downstream systems such as TraceTogether and Health Hub will then pull this information and display that information in accurate forms. So in summary, how OGP works amidst COVID-19, and actually for all our products, is 3 main principles. First, to move fast, meaning we don't overplan. And if the concept of operation is not clear from the outset, we'll try to build a prototype or suggest a workflow for our stakeholders to consider so that they can also have ideas that we could collaboratively bounce with each other and find something that works after testing this with users. Second is to keep things simple. Amidst complexity such as uncertain vaccine supply and uncertain user behavior, it helps a lot to keep your operations and your technology as simple as possible, reduce dependencies, and build standalone systems if you do need to move very fast. And the third is to be users first. If you saw in the past picture, even though we had to move very quickly and the entire vaccination system is built within 2 weeks, we did not skip the step of consulting users and doing user tests with seniors to make sure that they know how to interact with our systems. The prioritizing users help us prioritize our features. And when there is pressure to include different features, be it by ministers or by committees, it really helps to keep going back to users to say, does this really work? And then that helps to inform the conversation around the design of the product. So yeah, I hope I haven't used up too much time, Manik. That is actually all for my presentation, and I'll be very happy to answer any questions after this.
Okay, thanks, Chiring. Very interesting to see how very small components, when stitched together, can create so much speed, agility, and help connect so many different resources together in just a few weeks. So pretty impressive. And I think we have quite a few questions coming up for you later. But let me now invite Jaslyn from TraceSafe. So Jaslyn is a veteran in the IoT and cybersecurity space. She's worked over 20 years as a SI as well as a telco professional. And I will not take any more time. But Jaslyn, we're running over. So if I can request you to keep it to maybe 10 minutes, and then we can do Q&A. And of course, people can connect with you after the session too. Right. Thanks, Chiling, and welcome, Jaslyn.
Thank you. Thanks a lot. In fact, I'm, as the last speaker, one of the key point is how do I keep the audience here as well with me? So I'm trying to go as interesting as possible. But before that, let me just introduce TraceSafe, who we are. So today, in fact, we are supposed to, give me a minute. Yep. So I've 4 items to run through, and let's go through them quickly. So when it comes to TraceSafe, in fact, we in Singapore outfits, we were just set up last year to support the Singapore Ministry of Healthcare for their quarantine, self-enforcement quarantine solutions using wearables. So since then, still now, in fact, we have quite a fair bit of achievements. Later, I will go through with them. But for TreeSafe, we do have two R&D teams, one in US and one in India. We ourselves, in fact, we design, develop, as well as productions of our own wearables, including the end-to-end to the back end, which is the software. That's why we are able to do a lot of data analytics. This is where our topics is about. So since last year, we have two achievements. What we look at is really looking at how fast that we can pivot to the very trying and uncertainty environments, right? So in 2020, we are the winners for the National Innovation Challenge, focusing on the construction industry. Later part, we have a case study on that. We are also been awarded for 2021 as a Singapore Business Review on the IoT category. So as an overview, what we are, in fact, is we started in healthcare. So if you go to Auckland, if you look at the children's hospital like KKH, you will see our systems. We do infant tracking across county in Auckland. And what do we do is to ensure, adoptions of infants. And when the pandemic came, in fact, Hong Kong government came to us and to look at whether are we able to come up fast enough a wearable self-enforcing quarantine solutions. So what we did was we started, we changed, what we supposed to be doing on an infant to an adult tech. So everything moved pretty fast. Within 3 months, we have a prototypes. Within the next 3 months, we have productions running. And we could do that is because developments, we have our own IPs, we have our own design house, we have our own production house. So we could do it all within 6 months. So by the time it was in June, we launched our first batch of our quarantine wearables. And that is where we went into further. So what we do is we use the solutions and we pivot. So the solutions that we developed for quarantine is called I'm Safe. So we move on within time span. We were contacted by mines industry. So this time is our world junior hockey, and they need to restart because they love hockey so much in Canada. So what we do is we bubble wrap them. So when all the hockey players fly into Canada, they were using our quarantine solutions. And what we did was we pivot again and we came out with another solution called All Safe. So All Safe is basically contact tracing, leveraging on our knowledge in healthcare, in looking at how is the best way for us to do contact tracing. And we do have our patents for that. In such a case, so that once they are out of their quarantine environment, they quickly move into the contact tracing. So within the span of 14 days or 13 days of games, so we are able to give them the platforms that within a click they are able to churn out reports, data that who are within the close contact, so that they can start to issue their QO list need to basis. And again, so what we do is we shifted again. So we move.
Sorry, Jocelyn. Sorry to interrupt. Are you changing your slides?
Yes, I am. Did you see the overview? I'm still at the overview, but at the industry.
Okay.
Yes.
All right,
Yeah.
no worries.
So that is the part where, from the mines, we go into the cruise ship. That's why, Royal Caribbeans will be using us. And, again, it's on contact tracing. But what we did was we combined the two features, the contact tracing and access to their cabins into one devices, so that there is a better ROI for that. For commercial, we are all looking at how could we make it at a better ROI. So that was what we do with, the cruise ships, liners, especially for Royal Caribbeans, or their flagships, cruises will be on TreeSafe. And last year, we took up a challenge. So again, it's all about users. So we do have users from the construction industry saying that, hey, I really lack of manpower, but yet I need to do quite a number of stuff. I need to make sure, social distancing is done, contact tracing is done, safety is done, work zone compliance to BCA requirements is done. So we took in all the requirements, and then we started a new product called Safe Sites. And this part, we pivot. We pivot in such a case that contact tracing is aftermath. But what we want is, how do we move on from after COVID, so that is post-COVID. So what we do is, using the data that we have, we look at how can we provide you a preventive, and a proactive information so that you can start planning. As what we highlighted, planning is key. So we will talk about that, in the later part, in more details. But what I want is to dovetail back. Whatever we did in NIC caught some attention from the manufacturing industry. So they need to do social distancing, contact tracings as well. So what we did is we pivot again in such a case that we provide them a solution. So in fact, we have our customer, which is first year semiconductor, Microns. After a long, POC, in fact, is evaluation of technologies, TraceSafe was being selected. So right now we are, in a way, we are being implemented across all their manufacturing site, including their offices. So that is how we pivot. Education is what we are going in now. So if you do have, challenge or challenge statements in the educations, do let us know. That is what we are keen to look at. So whatever that we are looking at right now, as of now, we are speaking, we are processing 15 to 20 million real-time contacts daily, based on the 800 devices that we have deployed on sites. So that is what we are looking at, is we have been collecting such a data. What can we do with the data? So we go into the preventive as well as proactive mode. So this is our wearable. This is just a snapshot of our wearable, not all our wearables. Whatever you see on the helmets, this is what we developed for the construction industry. So it's bright to ensure that everyone sees it, especially at night. It has huge sirens to make sure that everybody caught the attention. So if you happens to hear any background chipping sound, yeah, we are doing testing right now as we speak. So as what we have, as what I've highlighted, we own the end-to-end of the wearables. We design, we develop, etc. So we are customizable. So, and what we do is we ensure it's an easy integrations and allows you to, integrates into your existing systems. And as a US company, what we look at is we look at security and privacy. So we never give up on that. And still doing, real-time monitoring. And as what Manik as well as Syed, Chiling has highlighted, everything is changing in minutes or weeks kind of stuff. And compliance to government regulations, it's very fluid. So what we did was we make sure we comply, to the requirements, especially like CDC. Take it as our CDC, when it starts with the guidelines, the guideline is, if you are in contact with the C+, personnel for 15 minutes and more, then you'll be in a, QO list. But at the second, regulation that is coming in after, a good 3 months, they have totally changed it. They were saying that, hey, no, I want you to accumulative collect all this contact tracing informations, and anything that is accumulating up to more than 15 minutes within 24 hours, this is the list that I want it to be on QO. So what we did was we pivot and we ensure that our solutions complies to the regulation within a single click. And what are we trying to do? We are trying to provide data so that it minimizes your business operation disruptions. That's our key point. And moving that, I will let you know what are the actual things based on our case study. So this is Safe Site, a safer work sites for all. So for us, we only have 2 points to look at. How do we do preventive? how do we be proactive? How do we enable our customers be proactive in planning? It's not about the plan, it's about the planning. So we all know, okay, trace together, look at aftermath. That is where you are, that is where there's a positive cases. But what we want is, can we gather information that allows you to identify your possible risk if one got, if one of the staff get positive. So we all know work sites have so many subcons all coming together, collaborative to make sure that the site is complete. So our wearable will allows you to identify what is the social interaction patterns. And we will collect all this information, give it a contextual lens. You're able to understand, what happened in, is it happening in which location, what time, what kind of, which group are they, doing their intermingling, causing a huge problems. Because this is the one that I want to look at is social butterfly. Because these are the people, or these are the individuals that is creating the unlinked cases, or the spread of it is the highest. And that is where we want to focus. And once we have this piece of information, pass it to the company is able to do proactive planning, because they will know, hey, this guy, is coming in at this time and doing the integration, intermingling. What can I do to make sure that all these are minimized? These are precious informations for planning. So next is, how do we do preventive? Apart having masks on, doing, social distancing, etc. And, we can't have too many, social distancing ambassador going around in the work site, because everybody needs to work. It's productivity issues. So what we do look at is our devices work offline. Offline in a sense that they are individual, you don't need a connected, networks to be around. But what we do is, within the systems, if two of them are too close together, they will be burst. And once they take a step back and it's more than 1 meters, the bus stops. So that is what we do by, giving you a self-enforcement for preventive. And with all these COVID, measurements all in place, then there is where it starts to move to the next stage. Can we have one device for quite a number of stuff? Slightly a bit different from, the government approach. As basically is when it comes to, commercials, they all looking at how can I have one thing, to use more ROI. So that is where we go into the safety, the one that you see on your right side, which is we are able to identify, okay, if someone else is approaching the danger zone, and the workers within the zone will be able to notify, say, hey, do I need to stop work? We also goes into the BCA regulation of work zones. So we do have, a technology using the same tech again, okay, with sensors, we are able to identify whether this person is supposed to work in this work zone. And if you're not supposed to work in this work zone, again, the tech will buzz, and until you step out, then the bus will stop. So all these are, offline. And what we do is only when they go into, only when they step into areas like the pantries, the security house, the resting place, all this information will be loaded. So what are we trying to do? After loaded, that is where we do our data analytics. This is just a snapshot, just to highlight. So this is one of the snapshots that we have, that we are able to identify who is the one that is social butterflies, at what time, which date, who is he, socializing with. What can you do with this? You can do a lot. You can at specific times, you can do counselings, you can make sure that, your security guys or your, social ambassador is around to make sure that this is done. This is just on social interaction. We have another dashboard that talks about safety, that talks about work zone, who is the one that keep coming in. In such a case, I already tell you this is a danger zone, but why are you still approaching? And all this right now has no way to collect the data. And that is why we are enabling, we are the technology enablers, that we are able to enable it, and collect this data and pass it to the company, say that make a due diligence decisions. How are you going to plan to ensure that danger zones are kept out, work zones are complied? So very much what we are looking at data, but we collect data as well for your, for the customers to do their planning. And that ends my presentations. I hope I kept within. Yep, and that's it for us. Anything that you need to know more about TraceSafe, you can drop me a message. You can, email us and go to our website so that, you know us better. That's it, Manik.
Thanks a lot, Jocelyn. So we will open up for Q&A. I mean, we've had some Q&A coming in. Maybe I'll just start with you, given that you're on the screen already.
Yeah.
So one of the questions was, is there any pushback from like the workers from, wearing this wearable? Like, do they have any concerns?
In fact, is as of now, because we already did a trial. So what we did was, with the trial, it was an older device, and now it's to a newer device based on the workers' feedback. The workers are okay with the devices because it's on a helmet, and right now it becomes very small and unique, and it don't have much of a weight on them. So they like it in such a way that they know, oh, okay. So we do have, some of the videos that we recorded when they were working, when they were trying to work together and it start buzzing, and then one of them will stop and take a step backwards. The other guy will lean in and complete his job. So this is the part, that is quite interesting. That the acceptance is quite high, in fact.
Yeah, and thanks for that, Justin. And I was also thinking that because it's digital and sort of it can be configured remotely, if in the future, say, regulations change, if you say, okay, now social distancing is 2 meters, and now once people are vaccinated, then, you can come closer, or the regulations change, everything can just be changed, remotely. And maybe different countries have different regulations, but the same device, same software, but just a simple configuration change over the air, and you're good to go, right?
Yes, in fact, that is what we are designed for. So taking example for microns, when things get better, they reduce it to 1 meters. After which, they find that the second wave is in, not for Singapore, but for the US sites, then that is where they decided, no, I need to go back to 2 meters or 6 feet. So that is how on demand things change, configuration changes. So this has to take into the considerations when we design our devices.
Okay, got it. Thanks a lot, Jocelyn. Then I have some questions for Chiling. Hi, Chiling, are you still there? Yep. All right. So I think so. A few questions. There were a question around these OpenGov products that have been built. First, are they truly open source, and are they available for if people in the private sector or normal citizens in Singapore and maybe even beyond Singapore, if somebody wants to use some of that and build and enhance and build some other products around that, is that possible?
Yep. Okay. Yep.
So
Manik,
yeah.
just to test, could you hear me clearly?
Yes.
Okay, great. Yeah, okay, so a lot of our products are open source. So if you go online to GitHub, you can find Forms, which is one of our core products, and it's completely open source today. I would say other governments have actually approached us to use some of our open source products. Not all our products are open source because it does take time. Open sourcing is in and of itself a project. So for right now, we are focusing on meeting existing operational needs, and maybe in future, if we have the chance to, we might open source other products as well.
Okay, got it. And I mean, you mentioned that this is like an experimental unit, and in a way, it's like a corporate tech, but inside the government and working on public sector problem statements. Are there any plans to commercialize or monetize some of these things? Because some of the products are quite cool. So, I mean, I'm sure there are maybe companies who may be willing to pay you. Is there a mechanism to monetize some of the government assets?
Our current priority and focus is to serve public sector problem statements, and our largest stakeholder is our citizens, so citizens and residents of Singapore. So I think monetization and productization for commercial purposes is not really our top priority at all. I don't think it's a priority at this moment at all, actually. So we are still focusing very much on solving public sector problems at this point.
Okay, but then, so in the future, if say US or some other country approaches, it will be more as a diplomatic sort of goodwill rather than trying to make money from it.
We have approached collaborations in that spirit, yes.
Okay, all right. Thanks a lot, Chiring. Then, Syed, the question for you earlier on was that, like, how many people do you actually need to test to basically have a representative sample of what's happening in that country?
Yeah, this is actually a complex question. It's quite loaded as well, but I'll just simply say yes. Yeah, I think the sample, whatever samples that you have, it is a good indication, especially when we are looking at risk profiles. Modeling something with whatever sample that you have is still better than not doing anything about it. So simply put, yes, with caveats, and we can discuss in details on the quality of the data, the quality of the sample, but in general, yes. Yeah.
Okay, thanks, Syed. So, I mean, that's unfortunately, that's all we have time for today. But I mean, it was a great session for me personally. I also learned quite a bit, and it's interesting to see how, the speed at which we're doing the planning, and then from planning, we're moving into operation, ops tech, and then using IoT variables where you have real-time situational awareness of what's going on, and then focusing on prevention, rather than post facto, tracing. I think all great examples. I think we're lucky to be here in Singapore, and we would like to thank the participants for staying on till 5:20. We actually have a majority of people, even though we have gone much beyond the planned time. All of the people are here, and I would like to thank the speakers once again for a very enriching and interesting discussion. And I will always also request the participants to maybe just do a QR code scan, and if you can give the feedback. So with that, thank you and have a great weekend. We will leave the QR code on for a few more seconds so that you have the time to do that. But thanks again to the panelists and to our audience today. Have a great weekend.
Thanks. Bye.
Thank you.